And the hour of 10 a.m. having come and gone, the House Mental Health and Addiction Committee shall come to order. I have one replacement letter here, or maybe more. We're going to start with one from Leader McCombie. We have temporary member Amy Grant here to replace permanent member Joe Sosnowski. We have another letter from Speaker Welch bringing in temporary member Mike Crawford for permanent member Bob Morgan. And then we have another letter from Speaker Welch bringing in temporary member Rep Cassidy for permanent member Rep Johnson.
Sorry, one more.
Oh, one more. It's hard. We all have to be in 10 different places right now. We have temporary member Rita Mayfield here for permanent member Rep De La Rosa. Thanks for being here, Rita Mayfield. With that, clerk, please take the roll. With that, I was talking too fast. Temporary member Rep Mayfield is here for permanent member Rep Margaret De La Rosa.
LaPointe.
Here.
Katzmo. Here. Haas. Here. Davis.
Here.
Favorite-Dias.
Here.
Ford.
Here.
Gill.
Here.
Guerrero Cuellar. Bizardi.
Here.
Howder.
Here.
Lilly.
Present.
Myers Martin.
Here.
Morris. Mussman.
Here.
Rosenthal. Schmidt.
Here.
Severin. Tipsworth.
Here.
West.
Here.
Grant.
Here.
Crawford.
Here.
Cassidy.
Here.
And that is
18.
With 18 members present, we do have a quorum.
Mayfield.
Here. 19.
Do you have the bills listed somewhere?
Okay.
Thank you. Okay. All right. Bear with us today. Again, there's 100 things going on for all of us. We're going to hear 4 bills today. I'm going to read out what the bills are just so everybody knows, and then we're going to figure out the order. We're going to hear, not necessarily in this order, HB 5468 from Rep Cassidy, HB 4542 from Rep Grant, HB 4039 from me, Rep LaPointe, and HB 2929 from Rep Ford.
Anything before that, so.
Okay, Rep Cassidy, take your time, but we are going to start with you.
Add AGC to the roll.
We're going to add Rep Angelica Guerrero Cuellar to the roll. $20 members present.
And Rep Morris too.
We're also going to add Rep Morris, 21 members present. So take your time, Rep Cassidy. That'll give me more time, so seriously, it's okay. And whenever you're ready.
May I have permission to present from my chair?
Yes, please.
Thank you. House Bill 5468 is the latest in a long string of trailer bills to CESA, the Community Emergency Services and Support Act. We've worked with all the stakeholders. It is agreed there will be an amendment forthcoming that has not gotten out of rules yet. I'm looking at Jackson to confirm that that is still the case. So we will be back.
let me read the witness slips. We have 3 proponents, including 2 from DHS, Christina Smith and Louis Andrade, and we also have Mark Pesakovich on behalf of the Illinois Psychiatric Society. We have 1 opponent, Jim Kychek from the Illinois Sheriff's Association. Rep, do you have a proponent, hi Christina, that wants to give proactive testimony?
No, and again, we're going to be back, so I just figured we would do it then.
Excellent. Either way, Christina, thanks for your work at DHS. Thank you for being here ready. If there are questions, members, do we have questions or comments on this bill? Take it away, Rep. Tipsword.
Thank you. Just, Rep, do you have an idea what your amendment's going to look like, some of the key points in that?
No.
Very well. I will anxiously await your amendment then. Thanks.
Christina, do you have a notion of what's going to be in the amendment?
Good morning, Chair. Yes, I can speak a little bit to that. So the amendment that's going to be forthcoming, again, it was a collaboration between the state partners and advocates. It does pretty much preserve the bill's core components, but it adds additional clarifying provisions around coordination efforts, and then a lot of provisions around committee membership and meeting requirements, specifically increasing the number of individuals with lived experience. And then it also is going to remove the earlier provision that granted DHS rulemaking authority. And so those are the primary changes. Thank you.
Thanks. Take it away, Rep. Guerrero Cuellar.
I'm really going to need you to connect with Slaughter and Paprika. Me, probably. Couple questions. The training, do you have an idea of the number of hours that we're going to impose for the training?
I would need to get more information on how many hours that would involve.
Okay, and is this for every law enforcement, or is there just specific groups of law enforcement, like subdivisions within units, right? Like community outreach in Chicago Police Department has CAPS, which is their community outreach. Is it just for them, or is it for everybody?
I believe it would be for everybody. As far as the law enforcement requirements, I can say that it would require an overview of CESA to be presented to Illinois State Police cadets, and then it would require the Illinois Law Enforcement Training Standards Board to add community response options, including those involved with CESA, as a component to the crisis intervention training. So I believe that would be statewide, but we can get more information on that as well.
Okay, and then do you know that if any other trainings is going to provide any kind of training for those individuals who speak dual languages, right, who might need to answer those calls, but they have to ask the questions asked specifically in languages so they understand what's occurring?
You're speaking to the 911 call takers? Sorry.
911, both EMC, but also officers when they respond to the call.
Okay. That is an excellent question, and again, I would need to get more information on that.
Okay, and as we're answering the call, is there anything that ties in, like, for different areas, maybe officers don't know what services or agencies provide mental health services? Is there anything in the bill that says, here's a resource sheet for them so they can become familiar or anything like that? And the reason I ask is when I used to work for the Chicago Children's Advocacy Center, they used to provide trainings, so officers could come in and do specific trainings, and so they would get like a list of resources, and they would find that helpful when they were in the field, because maybe they couldn't provide a service, but they can kind of refer.
I don't know that CESA speaks to that at all.
Okay.
And that's, I mean, this is the underlying law.
Okay.
From, how many years has it been since we passed it?
You first passed it in the spring of '21.
Yeah, so I don't know that
I was
that,
just a freshman. No way I'm going to remember that one.
it was unanimous.
Okay, great. Yeah, okay, thank you.
Thank you.
All right. I am not seeing any other questions, but we do want to add Rep. Severin to the roll, clerk, so thank you for doing that. There being no further debate, Rep. Mussman moves that House Bill 5468 do pass. Do we have leave?
Will be partisan awaiting the amendment.
Okay, partisan leave awaiting the amendment.
15 to 7.
There being 15 votes in favor, 7 opposed, 0 voting present, House Bill 5468, and is declared passed and will be favorably reported to the House floor. Thanks, Christina. We are going to do Rep. Grant's bill next. So take your time, Rep. Grant. We're all about wellness in this committee. Take a breath, and whenever you're ready.
Thank you, Chair. Thank you for allowing me to bring this to your committee and for actually calling it. Thank you so much. I have here HB 4542, and I've talked to a lot of you already about this, whether you think it's a good idea or not, I don't know. But anyhow, this bill expands the definition of in one's own home. This initiative was brought to me by STARS Family Services, who operate 3 homes with 6 beds each and provides short-term respite support to adults with intellectual and developmental disabilities. Expanding the definition will allow STARS Family Services to fully utilize their homes and increase the capacity of alternative residential service options for adults with developmental disabilities seeking services outside the home and community-based service programs. Allowing service providers to fully utilize their homes could help address the thousands of eligible adults seeking service on the PUNS list. And I have some witnesses here. There's going to be 2 that are going to be sitting at this chair, and the director of STARS Family Services, her name is Sharon, and she will be here, and a board member, Glenn, will be here to testify. Esther and her disabled brother with her, and they will also talk to you. Thank you.
Thank you, Rep. Grant. We're going to take a pause and read the witness slips. We have 153 proponent witness slips, and of course we have STARS that filed witness slips. We have lots of folks filing as self, lots of folks self. Are we good, Leader Haas? We got the proponents. Opponents. We have the Department of Human Services is opposed, the Wheaton Christian Center is opposed, and the Illinois Guardianship and Advocacy is opposed. That Wheaton Christian Center, I'm wondering if that was a mistake. Okay, so just 2 opposed, 2 state agencies. And then 2 no position, the Illinois Municipal League, and somebody who's a former state representative from the area. Sandy Pihos. We love it when people pay attention to our work. So I bet we have proactive testimony, so we're going to turn it over to you, witnesses. Thanks for being here. Press the red, make sure the red light is on.
Okay. Chairperson LaPointe and members of the committee, thank you for this opportunity to speak with you. My name is Dr. Sharon Cotreyer, and I serve as the Executive Director of STARS Family Services. My professional training and experience includes more than 40 years in the field of intellectual and developmental disabilities in various states and over 8 years in developmental disabilities research. STARS Family Services stands unwavering support of House Bill 4542. As Executive Director of an organization that has served the Wheaton community for over 16 years, I urge this committee to champion this vital amendment to the Developmental Disabilities and Mental Disabilities Services Act. This legislation is not merely a technical update, it is a necessary protection for everyday life and dignity that our residents and their families have worked tirelessly to build. House Bill 4542 addresses critical limitations within the current definition of one's own home. The proposed amendment ensures that a resident qualifies as an individual owns home under broader, more realistic, community-based conditions. The shift from 3 to 5 allows friends to age together in a home they consider their own and in a community of their own choosing, mirroring the natural social structures found in any residential neighborhood. Since its inception in 2008, STARS Family Services has pioneered private, community-based supported living in Wheaton. We currently operate 2 homes for men and 1 for women, serving as a model of how architect of absolute inclusion functions in practice. Our residents, or we call STARS, that we serve, remain integrated within their local community, maintaining vital connections to family, friends, and their ministry at College Church. Our organizational footprint extends beyond residential care to include our respite program, which offers essential supports for families, the Partners Program, which cultivates deep community engagement, and our SFS Art Studio, which provides a space for creative expression and social autonomy. By passing House Bill 4542, you empower organizations like SFS to maintain these homes as true own homes, environments rather than forced institutional settings. The current 3-person limit creates a precarious Medicaid gap that serves as a regulatory trap for families. Representative Grant's legislation addresses a catastrophic risk under current law. If one of our residents live with 4 or 5 friends in a community setting, they risk losing their Medicaid eligibility. This is a modest regulatory adjustment that prevents a catastrophic loss of financial coverage. If families lose eligibility and can no longer sustain private community-based care, the state faces the significantly higher financial burden of placing these individuals in state-run institutional care. Expanding the threshold to 5 adults creates the shared expense sustainability necessary for nonprofit, family-led care to remain viable without taxpayer-funded institutionalization. The mission of STARS Family Services is to minister to the physical, emotional, social, and spiritual needs of individuals with intellectual and developmental disabilities in Christ's name. We believe that the state policy must reflect the inherent value of these individuals, that these individuals bring to Illinois' community. Progress happens when conversation shifts from limitations to possibility, and when communities choose inclusion as a standard, not an exception. House Bill 4542 is the legislative embodiment of this principle. It grants people the fundamental right to choose where they live, with who they live, how they live, and how they receive care. By removing the arbitrary 3-person cap, the committee affirms that adults with disabilities deserve the same autonomy and social connections as any other citizen. On behalf of STARS Family Services and the families we represent, I respectfully urge the committee to vote yes on House Bill 4542. This bill is a vital step in removing barriers to community-based living and ensuring that our residents can continue to live lives of dignity, purpose, and inclusion. Thank you.
Thank you so much for that testimony. Is there another witness that wants to make proactive testimony, or are you here for questions?
I want to make proactive testimony. Oh, sorry.
Excellent. We'll use your mic, and if you wouldn't mind shortening just a bit.
Sure.
Because we've got
let me
4 bills.
just say this much.
Yeah.
The state of DHS has given us an olive branch about 8 years ago. And what I mean by olive branch, they allowed the residents in the home to use home-based waivers. Anybody coming into the home could not use those. You know what? People pass away, people leave. We've had 1 pass away and 1 leave. We do need to fill those beds. I just want to tell you a little bit on the human side of this, though. I'm a dad. I serve on the board also of STARS Family Services. 12 years ago, I was with Jim Davis, a good friend of mine, and we were both facing cancer surgery. Jim comes to me and says to me, "I'm just so glad Tim's in the home." His son, our daughter was not in the home at that time. I said, "I'm glad, Jim." 6 months later, I lived, Jim passed away. You know, the reason we're here, the two biggest reasons that parents of this, the biggest fear of parents with disabled adults, what happens if we allow evil to permeate into their lives, and especially with a girl, use your imagination. And the other one, what happens when we die? And that is the key. That is why House Bill 4542 and these homes are so important. Christie is our biggest challenge, but our greatest reward. I maintain the facilities of Stars Family Services as a board member. That means I maintain the homes. I just want to say, I do that because I don't want another line item on their agenda. We cut. We do. We are streamlined. Sharon wears a lot of hats. We were talking about that on the way up here. We need your help in just letting us continue bringing in others with these waivers. I just want to say two more things, and that is, in 2024, well, I just want to say, we charge the residents $1,400 a month. That is nowhere near what you can live on. But we subsidize that with fundraising, with our resale shops, where Christy works. And Christy works 5 days a week. She works at the Wheaton Eye Clinic 4 days from 8 to 11, and then at the Stars resale shop on Wednesday from 10 to 2. We make sure that these adults are in the community doing what they need to do. Parents are involved. Once a week, parents get into the homes. We ask that they volunteer, I'm almost done, that they tell us what we're doing wrong and just engage with the Stars. It's so important that we have boots on the ground and accountability, and we do have that here. House Bill 4542 would allow us to continue what we are doing now, and we do need your help. I just want to say, we can do so much for the Stars. 38%, and I'll just give you one statistic, 38% of disabled adults in Illinois live in apartment or housing. In the national compass, it's 75%. We are well below that. And we can start to turn the tide with homes like Stars Family Services, and I just appreciate your support. Thank you.
Thank you so much.
But Shauna wanted to talk too.
I appreciate that. Two proponent witnesses is approaching our limit because we are on such limited time today. I'm so sorry, but if this bill comes back to committee, which it might, we'd love to hear more proponent witness testimony.
BJ came all the way down here, and BJ is
Okay.
That's all right.
Well,
We have to,
what we'll do
please.
is,
It's the human side of this. And I think you need to hear the human side. I'm sorry.
I'm the chair. Give me a moment. We have to have an order to things. Sir, believe you me, the members of this body, this committee in particular, and related to the issues of full opportunities for adults and kids with developmental disabilities is front and center for so many people in this room. You too.
Thank you.
And so I feel that, I hear that, and I just want you to know that we don't often hear DD issues in this committee, but most of the people sitting at this table have been leading on these issues for years, and I don't say that to say, look at us, we're great, but you don't know me, I don't know you, so this is just a way for you to get to know us. What I'd like to do, just to maintain some order so people can start crafting their questions, it's going to be a little awkward, but I think it's really important to hear from the opposition. So I'm going to have DHS or IGAC come to the table, and then we'll have the other person that you mentioned come to the table.
thank you, Chairperson.
Thank you.
Thank you, Chair and members of the committee. My name is Bess Johnson from Illinois Department of Human Services. So the department has serious concerns with this legislation. While the bill appears intended to allow one specific group home to house more residents, its language would apply across the state, which risks weakening the structure and oversight of home-based services for everyone, not just the one home, and would have negative consequences for vulnerable individuals statewide. The change would be detrimental to health, safety, and quality of services individuals receive in community-based residential settings. The changing definition would enable licensed providers across the state to provide home-based services under the new definition of own home, when it operates more like a group home. This is a major concern. It would allow the less invasive oversight designed for a person's own home-based service to apply to a group home. So in Illinois, home-based services are designed for small numbers of residents, usually 3 or fewer, to provide personalized, person-centered supports in a real home. And expanding the number of residents allowed under this bill undermines the very purpose of home-based services. We are also concerned with the bill's reliance on an undefined local, quote, local government authority for licensure. As written, it is unclear who would oversee these homes, what health and safety standards would apply, or whether there is enough expertise to ensure residents are safe. That ambiguity raises real risks and opens the door to unsafe environments for vulnerable individuals. The bill also expands the eligibility without additional resources, and increasing demand within the same budget will likely reduce services for current participants or leave more individuals without access. So instead, DHS and DD would like the opportunity to meet with STARS. We have been in communications with them already, and we look forward to understanding their concerns and working collaboratively. We can explore how residential model could fit within their current framework of federal requirements, waiver rules, and state standards. Thank you.
Thank you, DHS. IGAC, do you have anything to add?
Good morning, Chair and members of the committee. I'm Tanika Jennings, Director of Legislative and External Affairs with the Illinois Guardianship and Advocacy Commission. I will submit my oral witness slip. I had just submitted a record of appearance. We largely defer to IDHS as the agency of jurisdiction over the waiver funding in this particular case that's been referenced, as well as licensure of these kinds of settings. That said, I have had some good communication with Representative Grant over the last week, and we resonate with the concerns that IDHS has shared. Our concerns are specific to individuals served under GAC's Office of State Guardian, or OSG as we say. We serve as a statutorily mandated legal guardian of last resort for individuals with disabilities who are adults and do not have anyone else who can serve in that capacity. So for our Office of State Guardian, and for the reasons that IDHS has already shared, this bill presents concerns about the well-being of individuals under guardianship who reside in those home-based settings. As IDHS has already shared, we feel that limiting the number of people in specifically home-based settings, which are intended to be home-like environments, such as a person's own home, there's a different level of oversight and care needed to ensure not just the safety of the individuals who might be covered under that home-based setting, but anyone else residing in the home. And it helps foster the appropriate level of support with the staff on site, or the staff who in some cases sounds like may not be on site. But it's important to make sure that the appropriate level of oversight and care is there. And we do, there are other settings such as SILA settings that do require significantly more oversight and are still considered community-based settings and less restrictive than, for example, a state-operated developmental center. I hope that is helpful. Again, we largely defer to DHS as the agency of jurisdiction, but do have concerns regarding the OSG.
Thanks so much. I'm sure that helps committee members prep a question or two. And with that, we'll bring up the other proponent witness that is here. And please state your name in the record, and we'll just want to make sure you've filed a witness slip, which you might have already done.
that on? First of all, committee, thank you for even taking the time to have the discussion. I realize it's like an onion, many layers. I'm going to come at it from the perspective of a sister, newly legal guardian for my brother. I did submit an oral statement or witness slip. My name is Shauna Howard, and this is my brother, BJ Kettinger. You can wave. I became his legal guardian in 2022 following the death of our mother, and our father then moved into a senior community. And stepping into the shoes of being a legal guardian it's been so much that I never imagined. And so many good things, so many challenging things. And as a sister, one of the burdens I bear, it's a little different than my parents. They certainly had the question, what happens when we're gone? This was always the plan, that I would step in to be his legal guardian. I now have the burden of what's my plan for when I'm no longer able to take care of him. And legally, our oldest daughter is the next in line. And so if I don't find placement for my brother in a place that I feel is safe and trustworthy, then I risk putting that on our daughter, who would have to stop everything in her world. She doesn't live in Wheaton. She is newly married, hoping to start a family. And that's a burden I don't want to leave on her shoulders. And so I feel it's my responsibility to find a place for my brother. And I recognize the challenges that were just presented. I hear that heart. But on the flip side, the Stars homes are not the only homes that would be privately overseen homes that would benefit from this. I'm sure there are wonderful other private homes that would benefit. And the peace of mind for us to know that we could place him in a home where we trust the values, we trust the staff. He's already known because he knows these people. He works with them. He does activities with them. So transition is a hard thing for this community. And to transition him into a home where he knows nobody, and then he's got to process getting to know new people, he's got to process why he's even living there, he's got to process maybe another death in the family, whatever, it's a lot. And so to be able to transition him into a place that he already knows, it's a huge benefit. And honestly, as my husband and I started this journey, we have never been told why we would lose home base waiver. Now I understand that it's this number 3. But even our Service Inc. representative has not been able to tell us why home base waiver would go away. Funding for living in the Stars home, you've already heard that they have significantly dropped the rate to the families because they do all the fundraising. But even that, BJ's SSI and SSA would not cover that. So where do we get the balance of it? We're in the process of moving him into the home, Lord willing. Being able to keep the home base waiver would be a huge benefit, because it helps then cover the gap for his monthly living, but then also the expenses for participating in his day program, for participating in Special Olympics and other community events where payment is required. To take that away, it places a huge financial burden on families. And there are families, frankly, who then can't afford it if you take away the home base waiver. So I would plead on that side of it. It's not something I understood, honestly, until becoming the legal guardian. It puts a different perspective on things. And I would ask for your support.
Thank you very much for your testimony. Appreciate it. Before we turn to others, I just want to ask Rep. Grant directly, so we don't prolong a discussion. Rep. Grant, are you willing to work with DHS to see if you can get more agreement than you have today and bring an amendment back to committee?
Yes, I very much I've already realized that was going to be the case, because they have their objections, but they're also saying that they're willing to work with us. So I would like to pass this bill out of committee and commit to holding it on second until we can get a good, clear wording for this bill that'll make our opponents happy.
Okay, excellent.
Does that make sense?
Yep.
Okay, thank you.
Leader Haas, do you have anything you want to say? No, okay. Any other folks want to say anything? Leader, Rita, Rep. My friend from Waukegan, we're so glad you're here. Take it away.
I don't normally sit on this committee. I'm glad I'm here today. This is an issue near and dear to my heart because I have the Kiley Center in my district, and we've had a lot of work through with moving individuals out of the Kiley into the SILAs and into some more community-based organizations. I am in agreement with DHS in regard to the at-home versus a group home. I have just some concerns. I'm not familiar with this particular organization, but at-home is a home-like setting. You know, I don't know if we're piling individuals into rooms. Does everybody have their own room? What does this facility look like? I've got concerns as far as that. Is it going to be similar to like the state-based where everybody has their own room, but they're sharing a living room and a kitchen? Somebody is preparing these meals. I just have a lot of questions on what at home is, because at home truly means you're at home and, you know, family members are preparing, you know, you're preparing meals together. You're not doubled up in rooms with individuals that are not legally relatives. So I do have some concerns, and I do want to make sure, because we are talking about this particular population that does not have a voice for themselves, we are their voice, that they do have that dignity of having, you know, separate rooming quarters, sleeping quarters, that kind of thing, and that they have all of the protections that they absolutely need. I don't want to create these group homes in the hope of just getting more money from the state. I want to make sure that dignity is being preserved. So I'm glad that you're going to work with DHS, because my first question was, are you going to hold this? Because I wouldn't be able to vote for it otherwise.
Yes, I am going to, and I do understand your thoughts and concerns. This is for the whole state. This is these homes are absolutely beautiful. Everyone has their own room. The city of Wheaton was thrilled when they tore down the ugly houses and put up these beautiful new group homes. And it is very much a home. It's a home. When you walk into these places, it is a home. But I do understand that not all group homes may be as beautiful as this one. So I'm willing to work with DHS and see what we can do. Thank you.
Thank you so much, everybody. Okay. My one question for the record, I'm just going to say it. We're not even going to talk about it. What DHS brought up about the local government that would license this home. I have an open question there, but we'll take that conversation offline. So, with that being said, there being no further debate, my friend Representative Howder moves that 4542 do pass. Do we have leave?
We have leave, looking forward to an agreed upon amendment coming back to us, yes.
Great.
The clerk's made some changes already. Can you add Morgan and Gazzardi back to the roll?
Okay, we're going to add Rep. Morgan and Rep. Gazzardi back to the roll, and that puts us at a magic number of...
What do we have? 20. I'm going to do Barbara for Rep. Morris. So 22.
Okay.
One more replacement.
We got to clarify the role here. We have a replacement letter to bring in Rep. Hernandez for Rep. Morris. And that puts us at 22. So there being 22 votes in favor, 0 opposed, 0 voting present, House Bill 4542 is declared passed and will be favorably reported to the House floor.
We can do Ford's bill.
Thank you, Rep. Grant. We are going to next hear from our friend from the west side of Chicago, Rep. Ford, on House Bill 2929,
Floor Amendment 4.
Floor Amendment 4. And I believe you have some witnesses come to the table now. We'll save some time. Take it away, Rep. Ford.
Thank you very much, Chair and members of the committee. I move for the adoption of House Floor Amendment Number 4. It's a gut replacement. It becomes the bill. And I do believe that we have a witness that could speak to the merits of House Floor Amendment Number 1. I would make note that I will be working with ASKME. ASKME has asked that we consider a technical amendment to address their concerns as it relates to the educational program and who's going to administer the program. I've made the commitment to do that and look forward to having an amendment, a technical amendment that they believe will fix that problem. Thank you very much, Madam Chair, and I'll turn it over to your witness, our witness.
Thank you so much. Take a pause for witness slips. We have 75 proponents, including the AIDS Foundation of Chicago, ACLU of Illinois, the Jolt Foundation from Peoria, Porchlight Collaborative, Illinois Collaboration on Youth, Cook County Department of Public Health, NASW of Illinois. We can leave it at that. Opponents, we have 229. A lot of a lot of individuals are against this amendment. Illinois Federation of Republican Women, Illinois Family Institute.
Mostly self.
That's it. A lot of selves. I do want to just say for the record that the degree to which an amendment is technical is decided by the leadership team, so we shall see if something has to come back to committee, not up to me. And take it away, ACES. Just state your name for the record.
Good morning, everybody. My name is Asis Lita. I'm with AIDS Foundation Chicago. Thank you, Chair, members of the committee. I'm sure you have all heard about this bill for the past number of years. I'm honestly really grateful for the stakeholders that have stepped forward to work with us to make this bill better. I wanted to give a recap from the last year. We have spoken with our Chief Behavioral Health Officer, Chief Burnett Ziegler, about the funding components around the overdose prevention site. So one thing that we did want to assure members of the committee is that there would be no fiscal impact to GRF. As it stands this last year, the Opioid Remediation Advisory Board did approve funding for the pilot site, but in May made a decision to pause those funds until legislation is approved. So funding is available, but it requires state legislation. With that, before you, we did provide sort of a read-along guide on the changes of the amendment. There were a lot of components that we tried addressing from committees that were brought up this last year. So before you, you have essentially 8 major changes that were included in the language of the bill. So going through that, the first change was changing the under this act in accordance with this act. A lot of that was concerns about the immunity language being all encapsulating, but in reality, we wanted to make sure that it's in regards to maintenance activities related to the overdose prevention site pilot. Then you move into the concerns around public safety. So in response to that, we introduced an advisory board that would oversee the implementation process. So answering the very technical elements of what are best practices, and then also ensuring that law enforcement would have a seat at that table to help create and strengthen partnerships on the west side of Chicago. Then there were concerns that were presented about the pilot location. So rather than authorizing one location, there would be a rulemaking authority that would be granted to DHS to help propose 3 locations. And in case some of them don't become viable through the rulemaking process, there would be a final approval of 1 location. And on top of that, there would also be city approval. We've spoken to the city, and there are no concerns from the city of Chicago in regards to the final approval of the pilot location. Then we get into the very technical components of the immunity clause. So what we did is we were a lot more specific in terms of the immunity language. So if you turn to page 9 of the language, you'll see that in highlighted text, we're speaking on the provision of law prohibiting the possession of controlled substances. That's the limited immunity that's provided. There was concerns about folks being potentially targeted in having an association to the facility. So this, at the very bottom, you see the other highlighted text that includes solely for the person's presence of activities related to the creation, maintenance, or use of a pilot OPS. So this would not limit law enforcement from conducting other investigations not related to possession of controlled substances. So again, emphasizing that this is very limited immunity. And then the other piece was the concern about the length of time that we would be approving the pilot. So there was a sunset clause that's introduced. So from the start of operation, this would sunset 5 years after the fact. And with that, that was a very quick run through. I know we're limited on time, but happy to answer any questions.
Thank you so much, ACES. We're going to do a little business here. I am going to open the roll because we have a member, Leader Lilly, who is here who cannot stay.
Just read that.
So, for the purposes of these logistics, Representative Cassidy moves to recommend that House Floor Amendment 4 to House Bill 2929 be adopted. Clerk, can you call on Leader Lilly?
Leader Lilly. I vote yes. Okay.
We have another member who wants to vote now due to some other obligations. Clerk, can you call on Rep. Mayfield?
Rep. Mayfield.
Yes.
Okay. Yes.
Thank you both, ladies. We appreciate that. Okay. Do we have, first of all, ACES, thank you for being really proactive and anticipating what the questions would be. We took a deep dive last May. Many of us were here for that. So do people have questions or comments for the record? I know Leader Haas does, so we'll let you start.
Thank you, Madam Chair. Yeah, I have quite a few questions, and I think a few of my colleagues do as well. So probably some points of clarification I'll need from changes from the last version as well. But I'll start sort of from where you started. So tell me a little bit about this advisory board. Who will be identified? How will they be chosen? Are they appointed? Tell me a little bit more about that process and what exactly will their roles be. I'll start there.
Thank you, Leader Haas, and I did try to reach out to make sure I had some sit-down conversation with you. So currently, as it stands, when you look at the language on page 3, this would include 10 members that would form the advisory board. And again, speaking to like the implementation of the overdose prevention site, talking about public safety concerns, community education, what does it look like to really roll this out, right? It's a novel approach. We want to make sure we're doing this correctly. So one member would be appointed by the Illinois Opioid Remediation Advisory Board. Right, this is appointed by the majority of the board. One member representing a Chicago-based mental health society or association, appointed by the Department of Human Services. One member representing a Chicago-based nonprofit organization that provides addiction recovery services, again, appointed by DHS. One member representing a statewide organization, or 4 members, no, sorry. One member representing a statewide organization that has expertise in addiction medicine, that's also appointed by DHS. And then 5 members that are appointed by the governor as follows. So one person with a substance use disorder, a member that works in overdose prevention, a member who is a current or former law enforcement official, one member who's a representative of an association representing local governments, and one member who has experienced a drug overdose or has had a family member who died from a drug overdose. And that covers the list of folks that are in this board.
Okay, and all of those members are voluntary members, correct? Or are they compensated in any way?
No, it's voluntary.
Okay, thank you. And as we talk about the locations, we're looking at one pilot site, not 3.
Exactly. It's 3 because of the rulemaking process. In case a location doesn't become viable in that sort of timeline, we wanted to show that something is still available.
Okay. And you mentioned the rulemaking process. That rolls gracefully into my next question. Tell me about that rulemaking process. Who will be responsible for that? And that will roll into JCAR rulemaking, correct?
Correct.
So let's talk a little bit more about that and the time frame that will be involved in that.
So I can't speak too technical because this would be something that DHS would have to oversee. But again, this provided, because of in response to the committee concerns that were presented last year about, zoning limitations or can't be too close to XYZ, we wanted to make sure that there was more transparency in terms of where the location would be and making sure that it's appropriate. And we figured the rulemaking process would be the best way to move forward with that.
And DHS will be the responsible
Yes.
department for that? And is there a time frame then set in this process, this pilot process for that rulemaking process? We know that that isn't always a fast process.
Exactly.
this
There
is
is no
a-
proposed timeline because given, the way that JCAR runs, it's difficult to pinpoint an exact timeline on that.
So when the clock starts ticking, if this passes, this is a 5-year pilot,
Yes.
and rulemaking could take a year or more.
Yes.
So that's cutting into this 5-year timeframe, correct?
No. So the start of operations would be when the 5-year mark would start.
Which would be,
The opening the actual facility.
so the rulemaking process is not a part of that 5-year
No.
timeframe. Is that clear in this piece of
Yes.
legislation?
When you look at the sunset clause at the end of the language, you'll see that it's clear. It's at the start of operations.
Okay. I will let one of my colleagues ask a little bit more about the immunity piece. We talked, when this bill came to us, a little bit more, gosh, it was last year, wasn't it?
It was.
About individuals that might visit the site with their children and the exposure at that point, potential DCFS involvement, things of that nature. How has this bill evolved on that issue?
So we wanted to limit the amount of physical features of operation to be included in statute, which is why we also wanted to implement the advisory board to help advise on that. We have spoken to New York City as an example, and they don't allow folks that are under the age of 18, but accounting for potential differences in regulation or law in the state of Illinois, we would allow the advisory board to help advise on the best way to help address that.
Okay, you speak of New York City as a model that perhaps we're looking at modeling ours after. Is New York City's model based in law?
Theirs is a city initiative, so it came out of their mayor's office. And in the transition, the new mayor is also very supportive.
So it's based on an agreement, not legislation?
Essentially, but another model we are looking at is Rhode Island. Theirs was passed through legislation on the state.
Pardon me? Whose?
Project Weber in Rhode Island.
So Rhode Island has legislation?
Yes.
It's my understanding there aren't any other states that have legislation on this issue.
I'd be happy to follow up and provide that language for you.
I would like that.
Yeah, of course.
Please, thank you. Because my understanding is if this were to pass, Illinois would be the first state to pass legislation related to this or to legalize these sites.
Yeah, of course, and I'd be truly honored if Illinois were to be the first. We have set the precedent to make sure that we're addressing public health crisis the appropriate way.
Does this piece of legislation put age limits on who would be able to utilize the sites?
There is no age limits in language.
So
But
a
again,
juvenile might be able to come to one of these sites and utilize illegal drugs?
So again, this kind of goes into the purview of the advisory board, right?
I want a yes or no
Operations-
answer to that. A juvenile would be able to come to one of these sites and utilize illegal drugs, the way this legislation is written currently? Yes or no?
It's not written in language.
So yes, a juvenile, the way this is written, would be able to come to a site in Illinois and utilize illegal drugs.
I think it's important to note that a juvenile could come into the site and get help. This is not a drug facility, this is a place for help. And so if a juvenile comes in and they're addicted to a substance, this is where we want them.
they will also be allowed to utilize an illegal substance if they come in carrying that illegal substance. They will be allowed to use that, correct?
This is where we want them.
Yes or no? Okay, we'll move along. I think I got a clear answer to that they will. If there's a death at one of these sites, at this site, it would be a drug-induced homicide. I know that Narcan will often reverse that. Sometimes it doesn't. So it would be a drug-induced homicide. How will the police be utilized in a situation like that? Because it would be a crime scene.
What, you have facts that if someone dies on the site, it would be a homicide? Are you assuming?
I have reason to believe it would be.
Okay, so you have reason to believe, but you have no facts to determine that assumption.
Do you?
But it's your question.
Well, I believe that it likely would be.
That may be, and so we.
Could be,
all right,
yes.
could be.
If it were to happen in an individual's home, it potentially could be. There would need to be an investigation to determine whether it is or not. Will that be allowed to happen at these sites? Will police be welcomed in to do an investigation and allowed to be investigating these incidences?
So what I can say is that the facility in New York City, the large reason for their success is because they have a strong partnership with their local law enforcement, right? Having a mutual agreement about when there's a need for investigation, we can carry and proceed forward with. What we have seen is also this is a highly effective model in reducing the rates of overdose, right? It's very unlikely, and I feel like what we're ignoring is the fact that there are overdoses already occurring.
And it should be noted that there has never been a fatal overdose at a overdose prevention site internationally or in New York or Rhode Island.
And I'm very glad to hear that. Tell me about the relationship with your attempts to implement this with local law enforcement and trying to iron out some of these concerns then. How has that been? My understanding is law enforcement is in opposition to this bill.
I'm going to interrupt for a second because Rep. Cassidy wants to take her vote because she also has other obligations. So clerk, can you call on Rep. Cassidy, please?
Rep. Cassidy?
Yes. Thanks. Okay, go ahead, Leader Haas.
Sure. Yes, just asking for clarification on the
We
role
know
with
that law enforcement from Illinois did visit a site out of state, and so it's good that the bill would have them at the table. Once again, this does not set up the overdose prevention site in the city of Chicago. This allows us to do the work to see if it's something that we could do and how to do it.
Yeah, and I appreciate that, appreciate them, certainly taking the time to go visit the site and the involvement there. I guess I'm asking for clarification on the level of involvement with your discussions in crafting this bill on their involvement and knowing that they're still in opposition, and I would love to hear them at some point testify.
Let me just say that the level of
today.
involvement is that they will be appointed on the commission, and I think that's something that they wanted, and that's something that we provided. That's big involvement.
Wonderful. Yeah, they certainly would, I think, would have a lot to offer there. And again, I would love to hear their opinion today
Yeah, of
as well.
course. So in crafting this language specifically in the span of the last year, they've been pretty involved and engaged. I've made sure to outreach to chiefs, sheriffs, Chicago FOP, allowing them to see, before we even had the opportunity to really have this be formally presented on ILGA, the scope of immunity being provided, if they had any feedback on language recommendations, and they were openly and honest about sharing that they would still be and remain opposed. But at the time that I presented the language, they didn't have any additional language to present.
Okay, thank you for that. Also, just doing kind of a quick search on with the implementation and training and knowledge and availability of Narcan over the past just 2 years, we've seen a wonderful decline in overdose deaths. And I think, I want to commend the departments and the agencies that are doing the training and distribution of Narcan. And again, just doing kind of a quick search, it looks like we've seen, from 2023 to 2024, about almost a 31% decrease in deaths due to the fact that we have the availability of Narcan. How do you, I guess with that decline, and the increase in services and availability of this, I would anticipate that we're going to continue to see that number go up. So with that being said, are we going to see a decrease in need for services like what you're asking for?
It should be noted that the decline is in every demographic but Black men. And so we still have a large concern about Black men that's alarming, and the trend is still rising.
Okay, thank you for that. Before we do wrap up, I would like to definitely hear from those that are here today in opposition as well. Thank you.
Thank you.
Other questions, comments? And we're going to try to mix it up a little bit, so I will take some privilege here, then we'll go back to the GOP while the opponents can think about what they might want to say. If you want to say anything at the end of the day, it's up to you. Thank you, Rep. Ford, in particular for pointing out the really important fact that overdose rates are going down for many populations, but not Black men. Not Black men. And when I reread this amendment, there's a lot of new clarity in the bill that wasn't there last May. The bill is extremely clear on where this site would end up because it's based on overdose deaths data. And I have seen the data statewide and from the Chicago Department of Public Health, and the west side of Chicago has exponentially more overdose deaths than any other place in the state. And so we know the data is going to show that this pilot site has to be on the west side of Chicago because it's data driven. And to me, that just speaks, knowing about demographics, to that this site is going to drive down those rates of Black men and save lives. So I want to say that for the record. I also would like to say that I know advocates have been working on this bill for a long time. The harm reduction providers that get paid nothing or a little deserve a ton of credit for driving down those overdose death rates. And thank you, Leader Haas, for bringing it up, that we have made really good progress. We're at the precipice of many, many millions of people in this country losing insurance for mental health and addiction, and that would be Medicaid. And it's the exact population of single adults between 19 and 64 that are most at risk for losing Medicaid. So if we do nothing, I have major concerns that the rates that we've been making progress on are going to actually reverse. And so as people fall off the Medicaid rolls, to have something in their community that is driving down stigma, that is a way to seamlessly connect to treatment, I feel like is exactly what we need at this moment in time. So I just wanted to point out kind of where we are in the moment of time. And then finally, thanks for bringing it up, ACEs, but we are slated to use opioid settlement dollars for one pilot site. And that is something that the IORAB has approved, and you said it loud and clear on the record. The governor's steering committee, which is the steering committee, it's the governor's opioid prevention and recovery steering committee. They have looked at this and said, we need legislation to fund this. And opioid settlement dollars are not taxpayer dollars. It's money that our pharma companies who have behaved horribly and driven the opioid crisis, they have had to pay into the system. At one point, we had like $750 million sitting in a pot that we get to spend, and we're going through the process and getting the money out the door. But this is one of the things we can use a relatively small amount of that money for. So I just wanted to say that as we keep going in discussion. Maybe we'll hear from you, Mike, from FOP Lodge 7, and then we'll go to Rep. Grant.
Good morning, everybody. Mike Cosentino, FOP Lodge 7, and also now representing actually the state FOP also. First of all, Acer, we've been working on this a long time. We've had a lot of conversations. He's a great guy to work with. I really appreciate it. Is there an issue? There is an issue. We understand that. We don't have a problem admitting that what's going on now, probably something needs to change. I'm a dad. I don't know what my kids are doing when I'm not around. But God forbid I get that call one day. And I understand it, and I appreciate the work you're doing. And also, Chairwoman, my state rep, we've talked about this a lot. You brought me into the discussion. I really appreciate it. But where we're at this time with this particular bill, and we have moved, I think, mountains together, it's like a cake that's not baked yet. Unfortunately, maybe we'll disagree. Maybe we need some better lawyers in the room. But right now, there's some major issues with this bill. But you just heard one about juveniles. There's also about what people can be charged with, immunity. I know where he wants to get to, and I know where the other side wants to get to. But again, like a baked cake, it's raw in the middle. We're not far, but it's raw in the middle. It really is. But I appreciate working with you. I do. I appreciate everybody on the other side. I hope everybody can say the same about us. We're not stomping our feet, but at this point, we're adamantly opposed.
Appreciate that, Mike. Thanks for being in the room. Thanks for putting that on the record. That's important for folks to hear. Do we have, I know, Rep. Grant, I think we'll go back to you. Okay, excellent. Other questions, comments? We'll go Rep. Guzzardi, then Tipsword.
Thank you, Mike. Thanks for your remarks. Thank you, ACES, for your work. Thanks, Rep. Ford. Where did you get to? Rep. Ford, for your leadership on this topic. I just want to express that I think I was in committee last year. I think all of us were in committee last year when this was discussed. We had really productive, fruitful discussions, brought up a lot of important questions, and I think the amendment that we see here today reflects real significant progress on a lot of those questions. By your quiet nodding, I think all parties would probably recognize that we've made a lot of progress here. So I'm grateful to everyone's ongoing discussion about this, and I think the product that we're seeing here reflects significant effort toward consensus. Just on the point about juveniles, because it's been brought up, no one wants juveniles to be using drugs. No one wants anyone to be using drugs. Really, no one wants juveniles to be using drugs. The question, and it's the fundamental question of this bill, it's not about whether we think that this is a good outcome or not. It's like, do we want them using drugs in a dark alley alone, where if they overdose, they will die? Or do we want them, we have to live in the real world where kids are going to use these products, but we should do everything we can to keep that from happening. And in the world that we live in, it's going to happen. And the only question is, do we want them doing it somewhere where if they overdose, their life could be saved? Or do we want them doing it somewhere where if they overdose, they will die alone? That's the question before us. And I think that this bill is an important effort toward answering that question. Thank you.
Thank you. We're going to open the roll real quick for Rep. West. Clerk, can you call on Rep. West? And Rep. Morris?
Rep. West.
Yes.
Rep. Morris.
Rep. Tipsword.
Thank you for that. Look, I appreciate all this discussion, very important discussion. This is something we definitely should be spending our time on. So I'm glad this committee's taking that time. I'm glad the stakeholders are working together on this. I want to go back to the immunity thing for just a minute. I understand the individual who's trying to utilize the program. I understand some limited liability there. But I do see that we're extending immunity to staff members, administrators, including healthcare professionals, managers, employees, or even volunteers. So I think as you folks continue to kind of massage this to an end, I think we need to have some clear definitions. I mean, can someone just come volunteer at this clinic, and then do they have blanket immunity for the Controlled Substance Act? I mean, as I read this, I kind of feel like they do. So I'd be interested in your comment there.
Yeah, thank you, Representative. So for the most part, when this clause was brought up, is that folks were, there's fear that folks are going to be targeted, right? When drugs are involved, folks by association are also, you know, subject to interrogation, investigation, so on and so forth. And what I want to also emphasize is that this is not blanket immunity. When we're talking about the limited immunity that's being provided is the possession of controlled substances. And I kind of want to just emphasize that point.
Well, I think it says the immunity provided, notwithstanding the Illinois Controlled Substance Act, the Drug Paraphernalia Control Act, and any other provision of law to the contrary. That seems very broad to me. So that's my question. I don't want to belabor this. We've been at this a long time. I'm confident you folks will continue working. One last question. Are appointments required for this clinic, or can folks just stop in anytime?
That's a really great implementation question on how the operations would carry out.
Okay, I think that's something for discussion, because I think as you're talking about the and I know it would be very difficult to tell someone when you're in crisis, make an appointment, right? That's probably a horrible message. But I think that would work in the immunity side of things too, where at least if law enforcement is involved in someone, they know they're on the way there. It's not a crutch that just says, oh yeah, hey, I'm going to the clinic. So I don't know. I like the analogy of the unbaked cake. I think there's some more work to be done. I think the discussion is great, and I will stop speaking. Thank you.
Yeah, of course, and happy to follow up with you. I can talk with folks in Rhode Island, New York, to see what their best practices are regarding like appointments.
Okay, quick order of logistics. We have to add Rep. Morris back to the roll so the clerk can call on her. So we are adding Rep. Morris back to the roll. Clerk, can you add her back and then ask for her vote, please?
Representative Morris?
Yes. Here. And yes. Yes.